Metro on WDET, Detroit Public Radio. I'm Robin Vincent, and it is flu season. That means public health departments are promoting vaccinations. But over the past few years, local vaccination rates have been down, and more people have become wary of vaccines. Before the pandemic hit, Oakland County's approach to getting people vaccinated had been to focus on vaccine science and facts. In other words, tell people that vaccines are essential and encourage local pediatricians to maintain high vaccination rates. But in the last few years, the county has changed its approach to vaccine hesitancy. It's now trying to be more open, curious, and empathetic with those who have concerns. So what else is different about Oakland County's approach? And has it been working? To discuss that and more, we have Kate Guzman here. She's the Oakland County Health Officer. Kate, welcome to the Metro.
Thank you so much, Robin. It's great to be here today.
So historically, Oakland County health officials have led with science and facts around vaccinations, as I just mentioned, telling people about what vaccines do and why they're so important. Why were you taking that approach at one time?
I have been in public health for over 20 years now. I'm a public health nurse by trade. It's my background. And since the day I entered into public health, it's been the same. Just tell people the facts, give them the science, help them make their decisions by making sure they understand that vaccines are safe and vaccines are tested and here's the efficacy rates, just pushing numbers at them and statistics and pretty much hoping that they're making the decision we want them to, which is to essentially vaccinate. And this has been, every public health department I've worked at has had the same philosophy, the same approach. Even in my education, that's how we're taught. It's just how public health approaches vaccines.
Why was that approach misguided? Or what is telling you now that it was misguided?
Well, honestly, now coming out of the pandemic, we've learned so much about the community's thoughts on vaccines, the community's thoughts on being told what to do, honestly, being told what to do by the government. But at Oakland County Health Division, we actually started down this thought process before the pandemic.
Really?
So we were a little bit ahead of our time. Honestly, we started this idea in 2018. We had a provider meeting of our Vaccines for Children providers. Vaccines for Children is a program where providers can apply, enroll, get free vaccines for children with Medicaid, children that are uninsured, underinsured. Alaskan and American, Native American children may also qualify for this program. So we have this program, VFC, Vaccines for Children. We have annual provider meetings. In 2018, we were recognizing a few provider offices for having stellar vaccination rates. So high. They're in the upper 90th percentiles of having their kids in their practices up to date on vaccines. Everyone's clapping. We're giving them awards. Oh my gosh, XYZ practice has 98% of their kids 19 to 36 years old, or 36 months old, are up to date on their vaccines. And the meeting ended and our team was having our hot wash or our debrief. And we realized that the reason these practices had such high vaccination rates were because they didn't care for any children that weren't vaccinated. So what they were doing essentially is they were dismissing families from their practices that were declining vaccines or waiving vaccines or refusing to vaccinate. So by essentially getting rid of those families from their practices, they had very high up-to-date rates for their vaccines. And our team just had this aha moment after this 2018 meeting where we thought, this is not okay. There are so many practices in our pool of VFC providers that are working so hard to improve their vaccine rates and working hard with families. And let's change our philosophy of how we recognize providers. And that's where we started. That's how this all started. Let's have an award, a Good Neighbor Award or a Most Improved Award, where we're really recognizing practices that are thinking outside of the box and keeping those families in their care and working really hard to get them vaccinated.
Kate, so what you're saying is that these physicians who had these high vaccination rates had taken an all or nothing approach.
Absolutely.
And I'm guessing that that could discourage some families from even going to see their pediatrician if they think, well, this doctor is going to dismiss me and tell me that unless I'm willing to get all the vaccinations for my child, they won't give me a few of them. And so that in turn is not only going to dissuade some people from going to see their doctor, but it's going to potentially strengthen that mistrust in the medical system. Is that right?
Absolutely. This all or nothing approach really alienates families. And fast forward from 2018 through the years until now, what we really see are we have families with no medical home because they're struggling to find a place that accepts them where they're at, and meets their philosophical beliefs. And so by excluding families, you have children that are just getting care in an urgent care when they're sick, but have no medical home to really follow their well-being, track their progress, look at their overall health instead of just focusing on that one incident where they might have a cough or might have a stomach issue. So really we're finding whole families that are excluded from the healthcare system just because of their vaccine beliefs.
And having a primary care doctor is so vital in terms of being able to have early detection, right, of different issues. And as you have noted, to have a doctor who is following your growth and your progress when you are a little one. So help us understand how you get this message to the public. I mean, I know a lot of people, they do have a doctor that they regularly visit and get vaccinated from, a CVS. So there may be folks who are not interacting with Oakland County's health department. What is your interaction like with county residents on the ground?
We are working on multiple levels. So we have our own vaccine program. So we have 2 clinics, one in Pontiac and one in Southfield, and we vaccinate all ages, Monday through Friday. So we have a very active vaccine program on our own. We also have a team of vaccine waiver nurses. And I think this is a real essential piece of public health in terms of vaccine hesitant families where we can really make a difference. So in Michigan, every family that would like to waive vaccines for their children in public school, they're required to have a vaccine waiver on file, and that's filed through the health division. So they're required to meet with a nurse, have some education, have a conversation, and have this form filled out for entry, specifically for kindergarten and 7th grade at those 2 key milestones. And those families that come in, for us, it's such an opportunity to have a real conversation. So our nurses, they're passionate about vaccines. They want everyone to get vaccinated. They want everyone to follow that CDC schedule, but they realize that it's not meeting families where they're at. And so our vaccine waiver nurses are trained to use some motivational interviewing to really ask the questions. What is it that you're hesitant about? What are you afraid of? What are you worried about? Is it the ingredients in a specific vaccine? Is it the testing, the safety, the security? Is it the number of vaccines that your child will get all at once? What is really the concern of the parents? And they try to get to the root of it and find a solution. So for example, many parents with infants specifically are so worried that their precious new baby is getting 6 vaccines at a time or 7 vaccines at a time. And for our vaccine waiver nurses to be able to say, this has been tested and this is safe for your child. And this schedule that's been created allows your child to be vaccinated the quickest. So they're protected the soonest. That's the goal, right? We want them to be protected as early as possible, as young as possible, so that they don't get sick and possibly die from a vaccine preventable disease. But for our nurses to be able to say, what feels good to you today? Could you get 2 vaccines today? Could you get 3? And could you come back in a month, come back in 2 months, and stay on a regular schedule with us, getting 2 at a time instead of 6 at a time, right? Just to space that schedule out. This is a very unpopular process with pediatricians. And I know you have some listeners right now that are cringing hearing me say this. But for Oakland County Health Division, it's so important for us to start that vaccination process, whether it's by the book, by the black and white schedule, or by a schedule that's comfortable to the parents. It's important to us because we're protecting that child with each shot that they get.
So this is about building trust, and it sounds to me like it's almost transforming the way that we view public health, because historically, I mean, I've heard many epidemiologists say that you don't notice good public health. It's done behind the scenes, and that's how we know it's working. But what you're saying is you're taking your public health nurses and turning them into soldiers,
ambassadors.
It's a more peaceful way, yes, to a more passive and peaceful way to look at it. But you're putting them on the front lines. And it's with the hope that having this kind of one-on-one interaction can change some hearts and minds.
100%. And a really novel program that we started in 2023 was a community health worker program that was only focused on vaccines. And so we employed a very small team of highly trained immunization community health workers. They were available to our VFC providers. If a VFC provider had a family that was vaccine hesitant, but that provider office didn't have enough time to really invest in them and educate them and spend time with them, they could refer them to one of our community health workers who would follow up with them, go to their home, talk with them on the phone, whatever was needed to help just move them along their journey toward vaccination, right? And so that's how we look at it, right? I think that it's a journey toward vaccination. I don't think that any parent has this, well, okay, there are some parents that are absolutely 100% my child will never get vaccinated. Yeah. But for most parents, it's a continuum of comfort and discomfort, right? I'm nervous about this, but this one feels okay. And I'm hearing information from everywhere, from my mom group at school, from my older relatives, from my own mom to my pediatrician, right? I'm getting this information from everywhere. Who can I trust? They're nervous. So having these community health workers, in addition to the nurses I was speaking about, was another tool that we made available to the vaccine providers to help them, because we recognize how busy pediatric and family practice offices can be, and they don't necessarily have that time to invest in a family and have those conversations.
And yet, Kate, I think there are some people who might say, well, you're not pushing all the vaccinations, and all the vaccinations on the schedule matter. If people don't get vaccinated, it could mean that they pose a risk to others. So what do you say to someone with that perspective?
Actually, that's my fear, that I have listeners today that are thinking poorly of Oakland County Health Division because of the stance we're taking. And so I want to make perfectly clear that we embrace vaccines. We are as core public health professionals, vaccinations are such a key to preventing communicable disease. And this is just one way for us to reach our entire community, because really by our public health code, we are required to protect the entire community, all members of the community, not just those members of the community that choose to vaccinate. And so this is another outreach effort for us to reach every person in our community and make vaccines accessible to them. And that's our ultimate goal, reducing barriers to vaccination for every member of our community.
This is The Metro on WDET. I'm Robin Vincent. My guest is Kate Guzman. She's the Oakland County Health Officer. We're discussing Oakland County's new approach to people who are hesitant to get vaccinated. And Kate, I think one of the big questions now is, are you making progress? Are you making a dent with folks who are hesitant to get their kids vaccinated?
Looking statistically, you have to bear in mind that it takes a long time to see growth and to see improvement in a county as big as we are, right? We're 1.3 million people, so it will be a long time until we see real improvements. We saw a nice uptick right after the pandemic where we had dipped really low, like at the rate that we look at, I will say the most, is 19 to 36 month olds for a core childhood series, right? So we look at that. That's one of our benchmark metrics. And we would like that to be at 80%. We have never reached 80%, but that's where we would like it to be. Pre-pandemic, we were kind of mid-70s. Post-pandemic, we dropped down to 68%. That was a low for us. Now, we post-pandemic, we came up, we hit about 72%. It was a high for us. We were feeling really good. Our community health workers were out there. Our vaccine waiver nurses were trained. We felt like something was working. We had made some nice improvement. And then honestly, after the election, we've seen some decline again. So we're hovering just above 70% for that age range again. Now, I mean, it goes up and down. We do fluctuate. We stay around 70%. I'm not upset at where we're at, but I was happier when we were closer to 72.
You mentioned the presidential election, and that brings to mind the U.S. Secretary of Health and Human Services, RFK Jr., who has a history of vaccine skepticism. So you're saying that it has made it harder to encourage people to get vaccinated when some of the most powerful people in the country are saying otherwise. Is that right?
Yeah, I do see from a public health standpoint that vaccines have become highly politicized. It's such a polarizing topic. And so I find that families that may have not felt so strongly against vaccines are feeling that now, right? And so I'm hoping we're just riding this tide, and that overall as a community, we'll start to see some increases again when the topic is a little less politicized.
Kate, you said you've been in public health for 20 years? Mm-hmm. Has it ever been as politicized as it is right now, the topic of vaccines?
No, I have never seen it like this. Now, granted, this is my first administration as a health officer, right? So I am definitely looking at the world through a different lens versus when I was a public health nurse and I was doing home visits and clinical work and very focused on patients, one patient at a time. I definitely have a different viewpoint now. I'm looking at things differently from a different lens, looking to lead our health division through this time. And that's why this approach toward vaccines is so important to us. I really think it shows that we're evolving. We want to meet people where we're at. We want to build that trust back up in public health. And it's not all or nothing for us. We want to hear the voices of everyone in our community. And if we need to look at something differently, we should. We're lucky that we have a bioethicist from Oakland University that we work with, Dr. Mark Navin, and he's been essential in our vaccine work. The research that we're doing, the studies that we're doing, small scale, just surveys with our providers and really digging into this issue of providers that dismiss families from their practices. He's been essential in our waiver research process. Having a bioethicist working with us has really allowed us to look through a slightly different lens than I think other health departments do.
You're really valuing adaptation, it sounds like. Before I let you go, in the last minute we have here, for families that come from marginalized communities that have been historically harmed by the medical system, Black families, families of color, low-income families, what's your message to them about vaccines?
We are constantly trying to work in the communities with community leaders, finding trusted venues. So we have a really strong outreach program where we're working with community leaders to help them spread the message instead of us. Sometimes we know that not everyone wants to hear the message coming from the government. So coming from church leaders, school leaders, leaders within the community, even barbershops or salons, wherever we can get ambassadors, vaccine ambassadors out, we are trying to get everyone to spread the word. But honestly, please, just the science is there. That's my message to your listeners. They're safe, they're effective. Vaccines have saved millions upon millions of lives throughout history.
Kate Guzman is the Oakland County Health Officer. Kate, thank you so much for joining me on the Metro.
Thank you, Robin. It's a pleasure.
It's the Metro on WDET. Coming up next, Tia Graham gets to know Detroit sculptor and painter Donald Calloway. That's this week's installment of the Container Podcast. This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. Stay with us.